in a colloquy with Dr. Barrasso.
Without objection, so ordered.
Mr. President, this is, as I understand it, about 90 days since the President signed the legislation known to some as Obamacare, others as Medicare Reform Bill. But there's been some interesting developments in the intervening 90 days, as to quote the Speaker of the House, who said at the time, we, quote, "we have to pass the bill so that you can find out what's in it." And we are finding out what's in it. Remarkable events have taken place, and ranging from the implementation that means that more than half, 51% of all employees in 2013 will be in plans that aren't grandfathered, despite the President's comment that if you like your insurance policy, you can keep it. Nearly 7 in 10, 69% employees and 80% of workers in small businesses would lose their current plans within 3 short years. And I'd like for my friend Dr. Barrasso to explain exactly how that happens. But first, I'd like to mention the issue du jour, which of course is a headline on Politico this morning: Medicare tussle stymies Hill. Medicare tussle stymies Hill. Rift between Pelosi and Reid stands in the way of funding compromise. I think it would be important to recognize that the reason why we didn't do the so-called doc fix was because the majority didn't want to do the doc fix, which means not implementing the 21% cut in reimbursement for doctors who treat Medicare patients. That the reason why we didn't was because they had cooked the books on the cost of Obamacare. The fact is, they kept counting in to the cost in order to keep their commitment that it would cost less than $1 trillion. They kept counting in that there would be the 21% cut, a $281 billion difference over 10 years. So now the AMA and all of those people who signed up with this bill are now saying, why are you not doing the quote doc fix? We did the doc fix here on Friday, I believe, and it's now over to the House, and we will probably do the doc fix. But why the delay? The delay is simply because they didn't want to. On the floor of this House, of the Senate, they did not want to do the doc fix because of the budgetary impact on how they were selling this proposal to the American people. I'd ask my colleague from Senator Dr. Barrasso to comment on that, and also what we are finding out as to how many Americans are actually going to lose the insurance policy that they have. And by the way, there's also an article this morning, which was also predicted by some of us, entitled in USA Today, "Doctors Limit New Medicare Patients." One thing that my friends on the other side of the aisle might have forgotten: you cannot force doctors yet, or you haven't enacted a law yet that forces doctors to see Medicare patients, and therefore a number of doctors are voting with their feet in the respect that they are not enrolling new Medicare patients in that they would treat. I'd ask my colleague, Dr. Barrasso, if he would comment on the doc fix, and also maybe a better explanation than I've been able to give as to why so many people face the loss of their health insurance policy by between now and 2013.
Well, my colleague from Arizona is absolutely right. Here's a front page story, USA Today. I was reading as I was coming back from Wyoming yesterday, and in Wyoming over the weekend I visited with a number of seniors who are on Medicare, visited with family physicians who take care of the families in Wyoming. I've practiced medicine for 25 years in Wyoming, taking care of families, have lived under the Medicare rules and regulations. And here it is: doctors limit new Medicare patients. Surveys point to payment concerns. Doctors will tell you that the biggest deadbeat when it comes to paying for health care is the federal government. It's Washington. And more doctors are opting out, as my colleague from Arizona said, from taking care of Medicare patients because what they get reimbursed is so limited that it doesn't keep up with the growing costs of their liability insurance, the mandates that they have on them in terms of expenses of running a business. They try to provide health care for all of their employees. So item after item, those costs go up, but what the government continues to pay for taking care of patients on Medicare, which is an expanding group of people, is shrinking. And right here, you think about this, how Washington works and doesn't get it. Patients around the country on Medicare understand they're having a hard time finding a doctor. But nope, Centers for Medicare and Medicaid Services, quoted in yesterday's USA Today, say 97% of doctors accept Medicare. But what's the reality of this? In North Carolina, since January 1st, this article says 117 doctors have opted out of Medicare. In New York, since the beginning of the year, about 1,100 doctors have left Medicare. Even the medical society, the state of New York's president of their medical society, isn't taking new Medicare patients. And that's the
Mayo Clinic.
Well, the Mayo Clinic said we can't afford to keep our doors open if we're taking Medicare patients, and specifically in Arizona, where they have a wonderful clinic, best care in the world, in many ways, in the sense that early on in the health care debate, President Obama said we should use the Mayo Clinic as a model of what works. They don't want to take Medicare patients. They don't want to take Medicaid patients. But this health care law is cramming 16 million more Americans onto Medicaid. So what the president is proposing for the American people is something less than what he has previously said is the best in care. One of the other promises that the president made is if you like the health care you have, you can keep it. As a matter of fact, he gave a speech about a year ago at the American Medical Association meeting, and I'll quote, he said, if you like your health care plan, you will be able to keep your health care plan, period. He went on to say, no one will take it away, period, no matter what, period. Well, now the White House has come out with new rules and regulations about who really will be able to keep their health care plan. And in the analysis that has come out from the administration, over 100 pages, I had it on the floor here last week, what they've shown is over the next few years, more and more Americans who have health care right now through their jobs that they like, that they understand, that they know how to use. And as a doctor, I've worked with these patients. I know what it means to them to have a health care plan that they are comfortable with, that they understand, that they use, that all of the works have been done with the doctor's office and the hospital and the patient. They understand the whole thing. To have that change is very distressing for people. It's unsettling. But yet this government report out from the administration says within the next couple of years, for people who have their insurance through small business plans, almost 4 out of 5 of them may lose the coverage that they have. But across the whole board, including small businesses.
Is that because of a minor change in the insurance policy that they now have that then forces them out of the policy, even though there's a minor change? And maybe, Doctor, you could give us some of those examples of how minor they are, would basically force them out of the policy they have into the, quote, exchanges. Is that what happens?
Well, I agree with my colleague completely. I mean, what is happening is any sort of a change to a policy that someone has, whether they change the deductible or they change the copay or any of those things happen, that then that policy is disallowed as something you can keep. So by the White House's own admission,
some of those changes would simply be driven by pure economics and the escalating cost of health care, which clearly this legislation has no effect on.
Well, let's say you change your job. Let's say you move from one employee to another, or one employment situation to another. You could likely change your insurance. Most people do, because most people get their insurance through their work. But we will have a situation where over the next couple of years, a promise that the president made to the American people, another promise that the president made to the American people, will be broken. Well, you know, we haven't just seen it with regular insurance, and my colleague from Arizona is in a state with many people who are seniors, and a number of them on Medicare Advantage, a special program that speaks specifically to preventive care, coordinated care. People sign up for Medicare Advantage because there are advantages to being on Medicare Advantage. But yet, this health care law that was crammed through this Senate is going to cut massively from Medicare Advantage. 1 out of 4 people on Medicare is on Medicare Advantage, and they know why they've signed up for it. It's because the advantage to them. So as these...
One more question from my friend, and this is really kind of a hometown issue. 330,000 Arizona citizens who are enrolled in Medicare, who paid for it all their working lives, paid into it, are now going and have enrolled in this Medicare Advantage program, which gives them choices, are now going to have that severely impaired or eliminated. How does that happen? How is it when a program is offered to people who have paid in the system all their lives, they've chosen that Medicare Advantage program, and now it's going to be taken away from them? How does that work?
Well, it works when a Senate and a House of Representatives and a president think they know more than the American people. They say, we know what's best for you. We don't care what you think. That's what's happened here.
So they have pledged basically to dismantle the Medicare Advantage program?
And cut the money from it, the funding, so that people on Medicare Advantage who like it, like the preventive medicine activities of it, are going to lose those opportunities. And, you know, just since 2003, the number of seniors on Medicare Advantage grew from a little over 4 million to 11 million. That's because the seniors talk to one another and they know what the best deal is for them, for their money, for their and for their health. The seniors I know in Wyoming who have signed up for this said, you know, they want to make sure they have a number of these preventive services. Once they lose this, they're going to lose preventive services. They'll have to pay more. The cost for people will go up, in spite of the promise made by the president that he was going to get down the cost of care. You know, experts who have looked at this said, no, I'm sorry, it's not going to work that way.
Could I ask Senator one more question, and that is, did he have a chance to examine the $14 million, I believe it was $14 million or $18 million
the mailer?
Mailer, yeah, I was trying to find a polite word. Mailer that was sent out to all Medicare enrollees, and what conclusions he drew from that infomercial?
Well, to my colleague from Arizona, I did. I had a chance to look at that mailer sent out by the Secretary of Health and Human Services. I found it very misleading, and some have described it even as being a piece of propaganda. And the sad part is it was paid for by the American taxpayer. And the estimates of the cost have been $16 to $20 million of taxpayer money to send out this piece of mail that says essentially, and misleads, tries to mislead, but as my colleague from Arizona knows, the American people are too smart to be misled by this, because it tries to mislead them into saying that this whole health care law is actually going to strengthen Medicare. The seniors of this country clearly understand, as I know they do in Wyoming and in Arizona, that if you cut $500 billion, or $500 billion out of Medicare, not to save Medicare, not to save the program that's there for our seniors, but to start a whole new government program, that's not going to improve Medicare. That's money that is the seniors have planned for, know it's in their system, and it's being taken from Medicare to start a whole new government program. It is not for them. It is not going to improve Medicare. It is not going to strengthen Medicare. And that's why from the beginning, to my colleague from Arizona, I've said this bill is bad for patients. Now the law is bad for patients. 90 days in, bad for patients. Bad for payers, the American taxpayers who are going to end up stuck with the bill. And bad for providers, the nurses and the doctors who are trying to take care of these people.
Well, I'd like to thank Senator Dr. Barrasso for his leadership on this issue. Those who are interested in his website, which is titled Second Opinion, might be interested in gaining more information from that. Those of my colleagues might be interested in that. But I thank you, Dr. Barrasso, for your leadership on this issue, for your in-depth knowledge of it. And I noted at the luncheon that we had with the President of the United States, your attempts to inform the President on this issue, I applaud as well. I'm not sure how receptive the audience was to it, but certainly what you had to say made a lot of sense to me. I know that Dr. Barrasso shares my view. We're not going to quit on this issue. We're not going to quit on this issue. It's going to be repeal and replace, because we're not going to do this to the American people. And still, the overwhelming majority of the American people disapprove of this proposal. And as the Speaker of the House said, we have to pass a bill so he can find out what's in it. As they're finding out what's in it, more and more Americans dislike it. Mr. President, I yield the floor. I suggest the absence of a quorum.
Clerk will call the roll.
Mr. Akaka.